morning, Ma'am. I am Sia Laika Rafael, your student nurse for today. Can I know your name and age, Ma'am?
My name is Maria Cristina Fernandez and I am 29 years old.
So today, Ma'am, we will be performing the procedure called Leopold'S maneuver. And I will be using my hands to palpate your abdomen to determine the position of your baby and the presentation of the fetus inside your womb. Before we start, Ma'am, would you like to go to the restroom first? Because the procedure might be uncomfortable for you later.
No need, thank you.
First maneuver, fundal grip. Palpation of the fundal area to determine the fetal part in the uterine fundus.
To determine whether the fetal head or breech. When palpating, a head feels firmer than a breech. A head is round and hard. The breech is less well defined. A head moves independently of the body. The breech moves only in conjunction with the body.
Second maneuver, umbilical grip. Face the client, hold the left hand stationary of the uterus while you palpate. With the right hand on the opposite side of the uterus from top to bottom. Repeat palpation using the opposite side.
To determine the location of the fetal back, one hand will feel a smooth, hard, resistant surface, while on the opposite side, a number of angular nodulations, the knees and elbows of the fetus will be felt.
Third maneuver, Pollock's grip. Gently grasp the lower portion of the abdomen just above the symphysis pubis between the thumb and fingers and try to press the thumb and fingers together. Determine any movement and whether the parts feels firm or soft.
To determine if the presenting part has entered the pelvis. If the presenting part moves, round, ballotable, and easily displaces, it is not yet engaged. If the presenting part not movable felt as relatively fixed, knob-like part, it is engaged. If it is firm, it must be the head. If soft, it could be breech.
Fourth maneuver, pelvic grip. Place the finger on both sides of the uterus approximately 2 inches about the inguinal, pressing downwards and inward in the direction of the birth canal. Allow the fingers to be carried downward to determine the fetal attitude and degree of fetal extension into the pelvis.
To determine the degree of fetal head flexion or extension. To determine the attitude or habitus. Degree of flexion of the fetal body, head, and extremities, or the relationship of fetal parts to each other, to determine the fetal descent.
So, Mom, we are now done with the Leopold'S maneuver. Do you have any questions and concerns, Mom? Thank you for your cooperation, Mom. So, we are now done with the Leopold'S maneuver and the procedure with the patient. So, after this, I will be washing my hands and document my findings.